everybody. Hi. So we're here
Hello.
today, me and Ashley Dalton, and
Hey.
hi Elizabeth. I'll just make sure that
It is working.
it's working. Cool. Cool.
Yep. So we're a couple minutes early.
Yeah. How many people are waiting to?
There's two of us here. I'm just gonna wait for a couple more people.
Okay.
Yeah, I'm just gonna
Oh, hi
message some people, let them
Allison.
know everything's
Good afternoon.
amazing. I'm glad our team is showing up. And I'm just gonna warn everybody that Luna is here and she is playing, so you are going to be hearing her during the podcast.
Hey Sheila. Yeah, we just hope she's gonna fall asleep at some point, right?
Probably in my arms.
Oh, the mascot.
Yes, FND warrior mascot. All right. What time are we? We're 3 o'clock on the dot.
Yeah. Are we starting this or?
I guess we can.
Yeah. Yeah. Let's do it. Let's do it.
All right. All right, let's get started then. So, just to get started, my name is Ashley, and I am the founder of FND Warriors. This afternoon, we are having a little bit of a change of topic as off of what we wanted to go off of, but that's okay. We're going to be talking about memory loss. So, my friend and co host Elizabeth and I are going to be, as I said, discussing memory loss and how to cope related to FND. So we wanted to introduce you to our cause. We are a support group, and we're here to educate, provide information, and guide you through your F&D journey. We are on many different platforms, and we have a 24/7 chat on Discord. We know everyone's journey is unique to them and can be a roller coaster of symptoms and emotions too.
Yeah.
We want to make the condition more transparent so that there can be more awareness throughout the world. So going into FND, it stands for functional neurological disorder. It's a condition where there's a problem with how the brain sends and receives information, leading to symptoms that can mimic neurological disorders like strokes or multiple sclerosis. Symptoms can include non-epileptic seizures, weakness or paralysis, and movement disorders, but these are not due to a structural disease of the nervous system. Instead, they stem from issues with how the brain functions, often triggered by psychological stress or trauma. FND was previously referred to as conversion disorder or hysteria, but modern understanding treats it as more of a neurological issue rather than solely psychiatric. And just as a point we like to make is this condition is not considered to be a psychiatric issue or purely neurological, which is a problem with the nervous system. This leads to patients being transferred from one department to another because no department is taking responsibility for this condition. There's only few hospitals in the world that are creating a department and research for it. This podcast that we're talking about today, it delves into the world of memory loss and how it relates to FND. I don't know about you, but I definitely suffer from severe memory loss, partly due to past trauma, which I'll talk about more today, and how it can affect memory, and some cognitive issues, specifically memory issues. What about you, Elizabeth?
I am definitely getting some cognitive impairment on the daily. The thing I don't like is that it's so random, and I don't even know that it's happening because I don't remember that I'm losing my memory. So sometimes it's a little hard uh, to get into to talk with others because sometimes you don't even know if you been talking about that
Mm-hmm.
prior, or like
Yeah.
there's so many situations that are created with memory cognitive impairment and memory issues that yeah, it's a really weird symptom, I feel like.
It
Um
is. It's like you have deja vu all the time.
yeah, exactly. It's so weird. But yeah, it's so yeah, cognitive difficulties is a big one. I would say but it's individual with FND might experience difficulties with memory, concentration, or word finding. Um, they're often described as functional cognitive symptoms where there's a discrepancy between subjective complaints and objective test performance. It's sure that there are different cognitive difficulties like memories issues. I do have a plenty. Sometimes it's on the short term where it's like a few minutes ago I was talking to someone about something and I don't remember it, or it can be, yeah, I talked about that, but I don't recall it until the person is actually telling me again the information and I'm like, oh yeah, you told me already. I just forgot that that information was even
Yeah.
something, you know? Um,
Exactly. Yeah.
it's sure that forgetting recent conversation and events is really triggering because you never know how you never know if you're gonna forget. It's like
Yeah.
if you cannot rely on your own memory, what do you have? Sometimes it's just, yeah, it's really triggering to me, but I feel like you kind of accept it at some point. I feel like I've I accepted it, and most of the people around me knows about it, so sometimes they just are gonna let it go. And if I'm actually doing like much worse, they're actually gonna tell me like, oh, it's been a few days now that it's you've been having memories issues, and like just so I know, you know. So yeah, also it's very hard to concentrate sometimes. I'm having a hard
Very
time.
hard. Yeah.
Um,
Yeah.
some
Very hard
some
to
days
concentrate.
I can just go from one to another task every 5 minutes and never be able to concentrate. But it's just a subjective feeling of being unable to focus or maintain the attention on one task. And that's what I do. I just will go from one task to another, and it's it's unusually taxing, even though objective measure might not fully reflect this difficulty. So yeah, it's a really interesting one. How sometimes I cannot concentrate. And today I actually had a good moment where I had like a 30 minutes of concentration, and I was like, whoa, that is weird. Like I don't usually have like I'm
Yeah.
usually
You
not.
even told me about it.
Yeah, I know. I'm usually not
You
that
were so happy.
concentrated. Yeah, well, it's a relief that sometimes I can use my brain because I feel so weird, so unfocused on life when I'm just surviving on that unconcentrate. Like it's so when you cannot concentrate, how can you just deal with things? It's so hard. So you just need to do it
Yeah.
a little bit every day. Like the minute you have a little bit of concentration, you just go for it, and you oh, Luna.
That's Luna.
There's also word finding problems. This one I have too. Uh, Individual might experience moment where they struggle to find the right words during conversation, which can be frustrating and lead to communication challenges. Like just earlier, just right before the podcast, I was like, "What's that word?" And I was trying to explain the word to Ashley, and she was like, "I don't even know what you're talking about." She
Yeah, and there was no context. She's just like the thing, and at this part, and I'm like, what are you
and
even? talking about?
and
You need to give
it's
me some
and
context.
it's really hard to find the words because you know exactly what you need to say, but you don't know how to explain it. Like it's just a really weird I don't know. And sometimes it's just stuck in the middle of a sentence, in the middle of the curve of conversation. Maybe I get distracted. Maybe sometimes there's nothing, and it's just boom, like nothing happened. I don't remember the conversation that happened. That is so weird. I call it like it's a kind of a brain fog, but that happens really quick and really fast, and you just don't know what to do after. You're just a little lost and
Yeah.
looking around and what happened again? Like what were we talking about? And yeah, that happens to me every day, I would say. It's not the worst thing that happens, but it surely is limiting. Well, it's just it's a struggle. It's a struggle to just not be able to rely on your memory. Yeah.
Yeah. It
Um
is a struggle.
yeah, yeah. And the other one that I'm having a really hard time with it is functional memory disorder, which is a subset of functional neurological disorder. And as I published on the group the other day, there's like that umbrella of different disorder that are all kind of coming into FND. And the functional memory disorder, it is actually one of them.
So
Um,
Allison
yeah.
has a comment there. Says I have a friend that had a stroke many years ago and still has cognitive memory issues. We always joke that one another that they can tell the same story and neither one of us would remember. It's true.
I
It's
actually
absolutely true. Allison. That's a good that's a good point.
I actually had a friend that had a hard time with short-term memory, so she was always saying the same thing, but I was always forgetting what she was saying, so we were just having the same conversation, and all the other people were like, weird, like, what's happening with this? But I didn't know the story. I was like, tell me again.
Just
So
say it again.
yeah, exactly. So yeah, people got annoyed a little bit about that, but I mean, that's good for me because after a few times, I would say I retain the information better. But there's not a lot of people that will have a conversation many times for us to get it to actually get it into our brain and it stays there. Like that can be a lot. But yeah, Allison, that's a really good point. Um, so functional memory disorder, um, it can be explained by traditional neurological disease. It's really from a complex interplay of psychological stress, trauma, or a psychiatric condition like anxiety or depression. And so it's not due to structural brain damage or other neurological disease like that. It's just really weird. It's coming out of nowhere.
Yeah.
But here's an overview of the functional memory disorder, like memory loss, which can include difficulty with short-term memory, uh, or with long-term memory as well, such as not recalling past experience. I know Ashley, you had some problem with recalling past experience.
Oh yeah, I have a really hard time recalling past experiences. Just trying to remember something that happened just 20 minutes ago versus even something that happened more so with my short-term memory than my
Yeah,
long-term memory. It's just ingraining into my short-term memory is what's hard. But once it's in my long-term memory, I seem to remember it. It's just in my short-term memory, it gets like all jumbled up and mixed up.
yeah, yeah. Well, actually, my long-term memory. I realized that I was having a really hard time with long-term memory but also I realized that I had unprocessed trauma when
Yeah.
I realized that I don't remember a lot from my childhood or anything prior to my the last few years. And
Yes.
I'm
So
still young. I'm still young. I'm 27, but still, like
yeah.
from 0 to 21, I would say I can barely recall anything. It's so weird.
So that's called repressed memories. I've done that as well. I have a lot of repressed memories from my childhood due to trauma as well, from abuse from my parents.
Yeah.
So I have a lot of repressed childhood trauma.
Mm.
Um, from that, from also, I don't
Well,
know, my dog's doing
it's
from
actually
all.
it's actually about like FND can be triggered by many things, and trauma is one of
Yeah,
them. So it is surely probably a lot of FNDers have uh,
yeah, exactly, and
trauma.
they can relate to something like that, exactly.
Yeah, exactly. Um, Other symptoms of functional memory disorder can be confabulation. Individual might feel in memory, feeling like memory gaps with incorrect or fabricated information. That's so weird when we think that
But
something happened and it's not
yeah,
the way it happened. I don't know if
yeah, it's done in a way to protect, and I can attest to this. It's done in a way to protect yourself. It's done to protect your
yeah,
your memory, like your it's done to protect yourself. That's what
yeah,
it's done.
yeah. Your
It's
brain
done to
is
protecting itself. That's what I'm
yeah,
trying to say. Your brain is protecting itself.
yeah, exactly. And the thing
Yeah.
I always say is staying in denial is not a good thing, but when you don't even remember because of your tricking us and everything, that's hard.
Yeah.
That's hard to know.
Yeah.
Like sometimes when I was seeing my psychiatrist and my therapist, sorry, my therapist, and I I was telling him, well, I don't know what what are the problems because I don't remember them, and he's like, and I just realized that if you don't know what the problem is, you cannot process any of it. You need to kind of
Well,
go
exactly.
deeper in it, like go. It's so weird.
Yeah, exactly.
And the fact also that there's selective memory, that we can have memory for certain types of information, but others lost. Like I can tell you all the lyrics for all the songs that I've heard in like the last 20 years, but I cannot recall what I had, like what conversation I had 20 minutes ago, or even a couple of months ago. Like I don't, nothing, nothing. It's just it's really weird how the memory works sometimes.
Yeah, no, it is. It is really, really weird how the memory works sometimes. And it's done in a way to protect it. And that brings us into our next topic, the subjective experience.
Yeah.
Um, so with FND, it involves a wide range of symptoms that obviously can't be explained by another neurological medical condition, and memory loss is one such symptom. So the subjective experience might relate to memory loss um, in the context of FND in several different ways. One of them being a variability in memory loss. So this is a little bit different than the selective memory than in functional memory disorder. So it's just a little bit different. So individuals with FND might experience memory issues that are inconsistent or vary day to day. This could include forgetting recent events, difficulty forming new memories, or sometimes even a sense of time distortion where events seem out of sequence.
How would you say subjective experience is really different than
Yeah.
other problems?
Yeah. So a subjective experience is based, the way that I look at it is if you think of it as subjective and objective, there's subjective things that are things that 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 we'll start with objective. So our objective things are things that we can see, touch,
Yeah,
feel, smell. Subjective things are things that are based on our how we feel.
yeah, yeah.
So it's how our experience and how we feel it. So it's not something that we can measure.
It's like when doctors are are trying to get a diagnosis, but they all have subjective uh things,
Data.
data. Yeah,
So for example, here's a really good example. Um, the pain scale, they always ask you the pain scale.
yeah.
Tell me what your pain is on a scale of 0 to 10, 10 being the worst pain you've ever felt, 0 being no pain. That's a subjective tool, because that's not an objective. That's not
Well,
like
you cannot
testing
measure
your
it. You cannot measure it,
they,
and it can change from one person to another.
exactly, because your pain threshold might be different than my pain threshold.
Yeah, it's about perception and how
It's perception.
the tolerance of
Whereas
everyone too.
whereas measuring your blood pressure,
Yeah.
that's an objective test.
And that's why it's hard to get a diagnosis or to not be dismissed by doctor, because sometimes we just have subjective data to give them.
And
And
that's the problem with FND.
that's why they need to actually put into words on a sheet of paper, like, okay, so she's having this, and they need to believe you, and they need to, like, there are so many things that get into account, but that's why we're
So
being so dismissed, because
exactly. And I'm going to talk about all of the subjective things that are in the subjective experience. So the first one was that I spoke about was the variability and memory loss.
yeah,
The next one is the emotional impact. So again, the subjective experience often includes significant emotional distress due to memory lapses. This might manifest as frustration, anxiety about future memory loss, or a sense of losing one's own identity.
yeah,
Depersonalization, that was a question in our Discord group.
yes, true,
That's been a frequent question in our Discord group this week. Depersonalization. So that right there, the unpredictability of when memory issues will occur and can heighten this emotional toll.
yeah,
So that there, how do you subjective or objectively, how would you objectively
yeah.
measure that? You can't. So
No, you
that's a
cannot.
subjective experience.
Yeah,
So then that brings us down to coping mechanisms.
it's so unpredictable. Yeah, I just want to add that
Yeah,
the
go ahead.
unpredictability of this is really hard, because when you're trying to explain something, usually I use the term dynamic, a dynamic
Hmm.
disorder, which would be something that can change over time. Every day is different, every minute is different. Because sometimes
Hmm.
I get a new, like, just the other day I talked with you and I was like, oh, I have pain, or like, oh, there's a brain fog. Like, there's so many things that can happen on the daily and just come and go, or come and stay for days at a time. Like,
Yeah.
there's no range of how much or when. And I just started having functional seizure, which is not the topic today, but I just wanted to say that people were like, okay, well, when do we call the ambulance? Like, is there a time frame where we need to make sure that you're
It's like
okay? And
It's
I'm
like,
like,
no.
no, there isn't. Like, there's not, like, it's not even about the fact that there's no cure or no research. It's the fact that everybody is different, and we're kind of reacting differently. Not reacting, but we have different symptoms
Coping
di-
coping
and
differently.
and yeah, and different symptom, but at different lengths uh a lot of time. So it's just we never know how long it's gonna last, or if it if it's gonna last or not. Or like when I have a really good time, like I said earlier, of having really clear thinking, and I don't know how long it's gonna last for. Is it 30 minutes until that brain fog is back again, or am I
Yeah,
having the whole day? So the minute I know that I'm feeling a little better, I'm like, okay, I there are
right
things
on
that
it.
there are things that I need to take care of. I'm gonna do it right now because I don't know for how long it's gonna last. So it's really important that I use that time right now, you know.
Exactly.
But
Yeah, exactly.
it's helping to stay in the present moment and to feel how your body uh is like how you need to be make sure that you're one with your body, that you're listening to your body, and when
Yes.
you're in that present moment and just wait. I'm not gonna say waiting, because you're not waiting for things to get better, but you're if it's happening that it gets a little better, just go for it. But not do not
Yeah.
wait for better times either, because you don't know when the next one is
You
gonna
never know.
happen.
You know, because you never know.
So just live in the present moment every single minute. And if it's a lot to see in the future, don't do it. You don't have to. Stay in the present moment. I know there are things that need to be dealt with, but you don't have to think about the future every single day at every moment, because I know this is uncertain, and you never know. You never know how it's gonna go. So you
Yeah.
cannot predict anything.
Yeah. And then that brings us down to we were on coping mechanisms.
Uh, yes.
I think so.
No,
Coping mechanisms.
emotional impact. We did.
We did. Yeah,
Okay.
so coping mechanisms. So people might develop various coping strategies or various strategies to cope with memory loss, ranging from using external aids like notes or digital reminders to compensating with other cognitive skills. Awareness of these strategies can be part of subjective experience influencing their self perceptions in daily life management. So, this is a really good point
Yeah.
um,
I have like
because
so many lists. It's it's my
I
brain.
have so many lists. I have so many. Well, I have digital lists on my
Yeah,
phone.
me too. Me too.
Um,
Like notes.
um, like notes. Yeah, that's what I mean. I have so many notes on my phone. Um, I do it the new age way, not the old school way. My mother-in-law always used to say, "Give me," or she always used to give me notepads and note and pens and stuff. But I do it the new
It's
age way. I have a pen on my phone. Like
it's
I'm gonna do it the new age way
it's just that I know I'm gonna forget that piece of paper if I need it or
every
when I
time,
need
and I
it.
have my phone with me all the time.
Exactly. So and it's so easy. When you have a thought, you don't have to go get a piece of paper and everything. You just have to go on the notepad on your phone that is right next to you, so you don't have time to forget about, because that happens that
Or,
like just that thought come up, oh yes, I need to do that, and a minute after
or I'm
I cannot remember it. Like it's just,
or like you're sitting on the toilet and you're like, oh yeah, oh
oh
yeah.
yeah, exactly, like any time is a good time to take notes, and sometimes you're like,
Anytime.
oh, I could do that, or I could use, or I could, like, many thoughts that are just going on paper, because I know that I'm not gonna remember them the
But at the
same,
same time, but
or
at the
not
same
all of the
time,
information. Like you can like remember that whole the concept, but you don't know what you thought about.
but at the same time, that really does affect my perception of myself, because it's like, why do I have to have all these notes?
True. But I'm like, ADHD people do need that. Like there are many memory problems at
No,
home,
no,
and
I
I get it.
understand.
But I get it. Like why can I rely on my brain for things like that? It
Yeah, why
should.
doesn't my brain just work, and why can't I rely on my brain just to work?
Yeah, exactly. Oh yeah. I just don't. I have a trust issue with my brain, so I just that's why I
Oh,
did this.
you have trust issues with your brain? Try having 16 brain surgeries.
Oh my
I have
god,
trust issues
yeah.
with my brain. Okay, well that's not the topic of
Yeah.
the conversation today, so we'll just move on. So, identity and continuity. So, memory is crucial for personal identity and continuity of self. With FND, individuals might feel a disconnect from their past selves or worry about losing personal history, which can be profoundly unsettling. I'm also going to refer back to the comment that we had in our Discord group regarding depersonalization, because I think
Yeah.
that really um, is a very it was a very profound statement,
Oh
and
yeah, and I feel like I feel like we all
it was
had
made a
that
couple of
time.
times.
We all had a little bit of that in our progress, in a, like since our diagnosis, or even before. For people who didn't get the diagnosis right away, you kind of feel like, I don't know, lost. You
Yeah,
know.
yeah, I do. I think I really, yeah, yeah,
Can you
absolutely.
maybe give us a little bit of information about the personalization, that word?
Yeah, so I can actually give you. I actually had to look up what it was, because I didn't actually, sorry, my apologies. I didn't have to look it up. I had someone posted what it was.
Oh, on the group?
Um, in the group, someone was very, very helpful and posted what it was. So you talk for a minute. I will find it
Yeah, no problem.
if you
Um,
want to,
I
because that's,
well, I wanted to say something about you see what I mean? I had a thought, I forgot about it. I am just rethinking about the whole conversation over and over again. It's just how my life works.
so depersonalization is the sense of being outside of your body, or feeling like what's going on around you isn't real. Like, people around you, it just doesn't click, like that they're not real.
Oh my god. I never had it that much though. I
Yeah.
felt like I was having a problem with my identity in general, but the fact that I don't know if what I'm living is real. I know there's a deja vu. Um, People are having
Yeah.
deja vu, and it's like really triggering because they feel like nothing is real, or they just relive the
Mhm.
same thing, but it's not real information that they're living because it's just the brain creating it. Like it's so weird.
Yeah, no, and I was not the expert on depersonalization. I'll be the first person to say that.
Oh
I
yeah.
had to ask someone, because was not in my wheelhouse. But that's the great thing about our group, is that there's so many people that bring so much wealth of knowledge,
Yeah.
that uh, that I learn something new every day from our members, and it's great that if I don't have the information, that someone has the information.
Oh
So I
yeah.
that's what I love about
And
our
it's
group.
it's okay. Like Ashley and I don't have all the different
The answers.
um no, but all the different symptoms. Like we haven't
Yeah.
had all of them. I just had PNES, which is a non-epileptic seizure, like a week ago, and I never experienced it before. So I mean, there are things that I was like, I cannot relate. I don't know. But I know that I've heard someone who said something about it. And usually when I don't know about one symptoms, many other do. and they can give me a lot of feedback, and they actually are within the community. Like they have the same symptoms and they don't know. Like there was one with uh, sleep paralysis that I didn't think was linked to FND, but finally me and Ash were having the same symptoms, and I'm like, oh wait, maybe it is. You know, you never know what's gonna happen, what's gonna come up, and
Hmm.
what's supposed to be FND symptoms and what's not. Sometimes it's just you don't even know how to identify what's happening. Sometimes you just yeah, you just don't know.
Yeah, exactly. Yeah. So that brings us into the next one, social interaction changes. So memory loss can affect social interactions, making it hard to maintain conversations or social engagements, which absolutely it can be because you forget what you're saying half the time. The
Yeah,
subjective experience here includes fear or reality of social withdrawal or misunderstanding by friends and family who might not fully grasp the nature of FND related memory issues. And it's the truth because you
we
could be in halfway through a sentence and forget what you were saying.
yeah
It
exactly.
happens to me. You
And
could be halfway through a paragraph and forget what you were saying. It happens to me.
you always get the look from everybody like
Yes.
what? Like you don't remember what you were saying
Ugh,
at this
it's
instant?
the worst.
And I'm like, yeah, so just deal with it and tell me what I was talking about because I can't help it. It's just how my brain works now. And yeah, it's easier with people who are dealing with it on the daily, who knows about what's happening. But we have so many symptoms that sometimes the memory
We
loss
forget.
is just not the priority. So we're gonna tell people, oh, I have this, this, this. Like you have seizure, I have fainting, tremors, all the things, and memory loss is not the biggest one of them. So we don't tell them, and until we get that memory loss or something, we're like, oh yeah, I forgot I have that too. You know, it's kind of a
Yeah.
one that is not coming up as often, but is clearly there, and people are kind of learning about it the
Uh,
after the fact.
yeah. And that brings us into the sense of control. So there's often a battle for control over one's own cognitive functions. So a lot of time you feel like you're a passenger in your own mind. So
Mm,
it feels like in memory loss episodes, it feels like they're happening without your control, which can lead to feelings of helplessness or anxiety. So
yeah,
a lot of times it feels like an out of body experience. It feels like it just feels like the world is just happening around you, and like you've just lost control of what's going on.
yeah. You had one recently, right?
Yeah, it was really, really, really weird. It's there's no way else, no other way to describe it.
How did you grasp on realize? Like, how did you? Did it just come back like that, or
It just came back like that. It's also very, very weird.
wow, yeah?
I don't know.
You lose it 1 second and it's coming back in 1 second. It's like there's no real reason, there's no trigger, there's nothing that really
I
happened for
think
it to.
there was a trigger for me. I think there was a
Okay,
trigger.
okay,
Yeah, I definitely did have a trigger, and it came back eventually when I calmed down. It was related to stuff that has been going on. But yeah, no, I definitely had a trigger.
yeah.
Yeah,
But I would like to say that memory loss doesn't have to have any trigger. It can happen on the
yeah.
daily. We're not even talking about anything triggering, and it's just the brain is not braining. You know, it's we call
The
it
brain is not braining.
we call it
FND brain.
we call it the FND brain, and me
Yeah,
and Ashley, it's just how we put it on. Yeah, everything that happens that we forgot or anything is the FND brain. That's
FND brain. Like we should coin the term FND brain.
for real. Yeah.
We really should. So then that brings me down to therapeutic experience. So therapy or interventions for FND might include addressing memory issues through cognitive behavioral techniques, mindfulness, or other psychological treatments. The subjective experience here includes the journey of accepting, understanding, and working with or around the memory loss. So you got to accept it and just understand that your body is going to have memory loss and
Yeah.
work with it, around it, and hope that it comes back and gets better.
Well,
I've just
acceptation is a
accept
really big
yeah.
step of the grief, and
Yeah,
it's
it
a
is.
really
I like we should bring up the 5 stages of grief again.
it's
Like
but
this
we're having grief of all the things we're losing. We lost memory. We lost some, for sure, some freedom in some
autonomy,
way, autonomy. I cannot drive anymore. I had to grieve.
driving, yep.
I had to grieve driving. I had to grieve so many things. Grief is part of our. It's sad, but it's part of how we need to handle things now, and it gets better throughout time. Like grief is as much as you're getting grief process, doing it one after the other, and you're gonna get better at it. It's hard
Hmm.
to see to say because it's the with like deal with trauma and you'll get better. Like it's not the best
Deal
way.
with grief, you'll get better.
Yeah, or like, but it's because grief is because you lost something, or you had to, yeah, you have to grieve something. It's not a nice feeling to have, but it's
Yeah.
definitely something we need to be able to handle. And acceptance is a really big stage that a lot of people cannot do. Like, there are people that are gonna have FND their own life, and they're not gonna accept it.
Hmm.
Accepting it is really important, but that doesn't
Uh,
mean you're there yet. There are
no,
so
it
many,
doesn't. No.
because when you're at the beginning, you got your diagnosis or something, and you're just overwhelmed by everything. You're not ready to accept it. You just want to fight. You want to do something about it. But at some point, you'll like we all did. We wanted to find answer. We didn't. Blah blah blah. And at some point, the mind is just gonna accept it, but it's
Yeah.
not the first stage at all.
No. No. Not at all.
So yeah, that leads to diagnosis. I was talking about that. Um, it Diagnosis of memory loss involves ruling out other cause of memory impairment through neurological exams, imaging, or psychological assessment. It's crucial to demonstrate that memory symptoms are inconsistent or not following the expected patterns of known neurological condition. So it's really important to make sure that you're having testing before, because it can always be linked to something. I know there are lots of people that have damage in their neck, and it caused a lot of FND symptoms, but it's just something that is damaged that kind of mimics FND. So maybe sometimes it can be um, uh, something with your body that is wrong, but when it's not, it's your brain tricking you into doing the thing that you don't want to do.
Yeah.
But it's
Yeah.
important.
Exactly.
You'll have to go through all the steps and everything to get a diagnosis, because they need to rule out every single thing before they can say that you have FND. And that's why they call it a um diagnosis of exclusion. It's because you don't have all the other things, you have FND. That's what a lot of doctors do, and it's because of that.
Yeah. I myself, I had an MRI, MRI with contrast, a CT. I think I had every test under the sun before I got diagnosed with FND.
Exactly. And
I had a spinal. I think I had a spinal tap too.
and
Like, I had.
on the other hand, I saw a neurologist. He just took a little. tool, he kind of got me like I didn't have sensation of my skin on my entire body, and until this day I still doesn't. But he just tried to see if I was feeling anything on myself and like on my skin or anything. And I couldn't, and he was like, "Yep, I think you have FND," and he was right. But I had many other symptoms that got that build up after time, but the sensation of my skin was the first symptom, and that's how I got diagnosed really, really fast. So I'm grateful that I got diagnosed
Yeah,
really
you're one
early.
of the lucky ones.
Yeah, exactly, because there's a lot of people that don't have any answers, and they're just like, "Oh well, I don't know what I have, but I need to live with it." And I like they cannot claim disability because nobody knows what they have, and they cannot like they're in such a bad space that
Yeah.
I feel really lucky that I got a diagnosis. I was talking to someone this morning too. She was saying that she was having a really hard time with the diagnosis, but I'm like, you want to have diagnosis if you can. Like it's not a good like getting a FND diagnosis is not a good thing, but at least you know what you're going like what's what's the demon you're you're dealing with, you
Dealing
know?
with
Um
exactly.
you can like it's about retraining the brain, so at least you know that that's what you need to do, and you can
Yeah,
go from there. But if you don't even know, like, is it caused by my body? Is it caused by anything? You don't even know. So how can you even try to progress in anything if you don't know? So yeah.
exactly. That brings us down to treatments for treatment loss for FND. So it starts with education and reassurance. A key part of treatment involves educating patients about FND. They need to be explained their symptoms, that they're real but not due to progressive brain damage. That's really important because they need to understand um, that it's not an issue, like that there's no brain damage
Yeah.
and that it's not going to worsen. um, it helps reduce anxiety, which may exacerbate symptoms, which means which may make their symptoms worse. um, if
I
they understand that their symptoms are real and you acknowledge that their symptoms are real,
I would say
that goes a long way
yes.
in reducing their anxiety,
Yes.
because it acknowledges that their symptoms are real. If you go to a doctor and the doctor's like, "Yeah, you have FND, your symptoms are all in your head," that is so damaging.
Yes, it is. At some point, I couldn't even look into it because every time I was thinking about FND, I was having more symptoms. And that's something you need to
Exactly.
do. It's detach. You are not the condition. You are someone who lives with the condition. That's a really, really important thing to say because anytime you think about symptoms, anytime you're defining yourself as
You are not
the
the condition.
condition, it's it's gonna create more problem because the subconscious is a really big part of your brain, and it just depends on how you see life and how you like. I decided. I've always been positive, but a year ago I decided that I'm gonna just think positive and kind of send the right message to my brain that I'm not a condition and I I can get better, and I got better, you know. So it's
Amazing.
all about telling the brain what it needs to well, telling the brain what has to how you want it to react, how you and at some point it's just gonna make the link. And I've been doing a lot of hypnosis as well, so it's actually going with the subconscious. So it's actually the next subject, which is psychotherapy. I would add anything that helps with the brain and the mental health and managing stress, anxiety, depression is all good for us. Um, Actually, there's in psychotherapy, there's CBT, which is cognitive behavioral therapy, that has been a treatment that a lot of hospital that deals with FND have been uh, giving their patients. And CBT is about retraining the brain. That's 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 that. So that's what I'm saying. When you're telling your brain how it should work, it's giving, how is it called? Like subliminal messages, like
Yeah, subconscious.
subconscious, yeah, something like that. And it's just, it works. I don't know how to say, but it works. And
It's more like subconscious.
yeah, exactly. So when you're focusing on managing those problems like stress, anxiety, and depression, it improves memory function by reducing the psychological burden that might contribute to cognitive symptoms, you know?
Yeah.
So, really important one. I had a therapist for so long. I didn't myself do CBT therapy yet. It's just that I haven't found the right fit and the right institution to give me the CBT. But if you like, give you yourself every chances, and if you're getting across CBT or any psychotherapy, try it. You never know if it's gonna if it's gonna work or um always give yourself the best chance to win.
And that brings us to physical therapy. So those whose memories issues are part of a broader set of functional neurological symptoms. So if you have issues with your physical therapy or your physical body, physical therapy can help manage symptoms, thereby potentially, sorry, Luna is going crazy, thereby potentially reducing cognitive stress. So if you reduce your manage your physical symptoms,
Yeah,
it can help reduce cognitive stress. So
yeah. Well, any stress is not good for the brain.
good stress,
So
yeah,
as
exactly. Any stress
much
isn't good for the brain.
that's a really important. I was struggling managing emotion, managing stress, managing all the things, and it created more symptoms. But you and so you need to make sure with
Speaking of
FND,
that,
yeah.
yeah.
But
Speaking of that, I was having trouble managing and not speaking of physical therapy.
yeah,
I mean I was doing physical therapy, but I found a really good solution for that was Luna.
yeah, oh yeah. Any distraction is good. I would say
Yeah.
with FND, it's distraction and um I don't know what's the other one. I don't know. I had an idea. I forgot it again. It's just
Memory loss.
I'm just proving my point today by getting it's sometimes like too much information or like she said I had a point, she said something and I'm like, yes, that's right, blah blah blah, and I'm thinking about that one, but I forgot about the other one. Like it's not gonna come back ever.
Yeah.
Maybe it will,
No, it's
but you never
maybe it
know.
will, but you know. So that was physical therapy, and then that brings us to medication. As we know, there's no specific medication for memory loss with FND. Drugs might be used in managing underlying conditions like depression or anxiety. However, caution is advised as some medications can worsen cognitive functions. So that is absolutely true. So if you're on anything like pain medication or anything like that, that reduces your cognitive function and can worsen memory loss.
Oh yeah, for sure. Oh yeah. If you I personally don't have any medication.
Lucky.
Um but for sure if I had any that could help me with um anything, I would probably take it. It's just that it hasn't been. working, so I haven't took any. And the other thing with medication, I would say, is if you're feeling like you're getting worse, please talk with your doctor about
Yes.
reducing it or even like completely removing it. Um,
Talk with your doctor. Yeah.
all the time, all the time. It's really important to have uh, a good communication with your doctor. Um, and if your doctor doesn't really believe you, that is unfortunate. But I would try like the GP, like a general practitioner. If it's the one who's gonna give you all the medication and all the things, I would try to find someone who can like believe you and make sure that you're having the right person, because you're gonna feel alone in all of this if you don't have any support from your general practitioner. The other one is cognitive rehabilitation, which is strategies like memory aids, like we talked earlier. Structure routine are really important. That's a really big one. Since I never had a routine in my life, and since I started one about 6 months ago, I've been feeling a little better. Like, well, much better, because I feel like my body knows what's coming.
Yeah.
The fact that the body doesn't know what's coming is stressing it out, and it's not good. It's You need to reduce all stress. You need to eliminate them one after the other, and anything that can cause stress, you should be working
Yeah.
on.
Exactly.
Cognitive exercise is a good one too, like playing games, a little game on your phone, or even anything that can help you remembering. Might be employed to manage daily life more effectively despite memory challenges.
Okay. Supportive interventions. So, where you encourage social engagement in maintaining active lifestyle, it can also positively impact cognitive health and individuals with FND. So, being in a group like ours, where you're maintaining social engagement,
Yes,
even if it's just over the internet with somebody, at least you're engaging with someone on the daily, on,
yes.
you know,
It's
yeah,
really important not
it's
to
you
feel
do
alone.
do- yeah, you're not being alone. At least you're still, being engaged. You're still um, talking with someone, getting your feelings out there, getting talking about
Yes,
whether you talk to them about FND or whether you just talk to them about your day, talk to them about your how you're feeling, what you did for the day, whatever. We have a pet channel, we have a food channel, I'm
yeah.
thinking about putting a kids channel. Like,
We have a
there's a
meme
whole bunch of,
channel. A meme
sorry.
channel. We have a meme channel.
Oh yeah, we have a meme channel. Like, we'll probably have a gift channel at some point. Like,
Right? Well,
honestly,
anything
we should.
that should distract us from what's happening, and we can bond on something, should be a good reason to do it.
So
I know.
so and on that subject, in the comments, our Discord group is there. So if you have FND and you want to join our Discord group, go ahead and click on the Discord group and join us, because we would absolutely love for you to join us.
Yes. And what I wanted to say about supportive intervention is that at first, what I saw recreational therapist, and she told me that I was missing a sense of purpose for sure, because I was feeling like I was a burden and that I didn't know what to do with my life because I couldn't do much. And she said, well, try to do some volunteering. And I tried. And every time I was exhausted from doing so
Mm.
much. And that was just a couple of hours, but I could just do one every month. But every time after that, I was feeling a little better, even if I was exhausted. I had to go out, I had to talk with people, I had to do the things. it's also a hard thing that I found is that when you're going in a new place that nobody knows about your condition, you'll have to talk about it a lot.
Oh, yeah. So it's
And
that's exhausting in itself.
it's so exhausting. So most of the time I'm gonna go as like they're gonna ask if I
So
have a job and I'm like,
so wait a minute. What you're telling me is I should make a shirt that says I have FND, and then on the back say this is what FND is. Don't ask me any more
Yeah,
questions.
exactly. Oh yeah, for sure. Oh yeah. Oh, we need a shirt like that for sure. Because I don't want to talk about it. I've been talking about it with my doctors, with my friends, with my family, with all the people. I don't want to see a stranger and just talk about it over and over again. That is exhausting. And that's our whole
Yeah,
life. They're like, well, in our society, it's like, okay, well, what do you do for a living? And the second you say I'm disabled, oh my god,
yeah.
they want to know everything about it. They wouldn't even ask question if I had a real job. Like, oh, I work in a grocery store. They wouldn't ask about it. I should say that.
No,
I should say
exactly.
that I'm working like in a
You're
convenience
director of a
store.
non of a soon to be nonprofit.
But they're gonna ask about what? You know, like
I know
it's
it's true.
it's always every time like everywhere I go, it's something that follows me and it can be really triggering. So
I can imagine, yeah.
if you cannot deal with it, there's a group like ours where you don't have to talk about no, but you don't have to talk about things if you don't have to. Like you can just talk about your day and people are gonna understand it. You don't have to ask the question. But if you want, we're there. If you want to just want to talk about
Yeah,
any subject, we're there. We get it. We got you. You know?
yeah,
It's where it's
exactly.
different because we're all in this together, and that's something that
Exactly.
when you go in the open and just go in society, you'll get so many triggers and it's not the same. So I really enjoyed just going on just chatting or just our drop-ins meetings with FND warriors that we just talk about things. We can talk about most of the time, like in the beginning, we talk about our life or dogs or anything. And if we have
Always our
question,
dogs.
oh yeah, always. But if we have question, at least it's something someone is there to answer. And if we don't have question and we just want to spend a nice time with some other people, that can work too.
So come to
Um,
our drop-ins on Wednesdays.
yes, yes, we would really like for you to be there, and you don't have to talk, you don't have to even put
Show yourself.
your camera on, you don't have to do those things. If you just want to be there and see that other people, like just hearing other people that are talking, that's okay too. Like you don't have to be engaged in the conversation if you don't want to. I want to say about all that podcast that there is hope and progress can happen. I'm one of the people that really worked hard to get better, and I did. Despite the challenges, individual might also experience moment of hope, and that is really really true. Um, it can happen really unexpectedly too. Like memories can return one day and be gone the next day, or it can return for a little while. You never know. So there is hope, and just make sure that you're always trying to have that hope in you, because, like I said earlier, when you're sending your subconscious the right messages, you'll get a good a good feedback from it. So if you're telling the brain that there is hope and you can achieve progress, the brain is gonna retain that and try to do something about it.
Exactly. So that is our podcast. In wrapping
Yeah.
up our chat on functional neurological disorder or FND in respect to memory loss relating to FND, it's clear that this condition is unique to individuals that it affects. There's no one size that fits all solution here. Treatment is all about customization. We're talking a full team effort, doctors, therapists, and sometimes even occupational or physical therapists all coming together to manage symptoms in a way that fits each person's life, not just their medical chart.
Yeah.
The key takeaway: FND doesn't follow the degenerative path that like some other neurological conditions, but demands a focus on symptom management and quality of life. Understanding memory loss or any symptoms in FND isn't just about the medical side. It's deeply personal, touching on identity and emotional health. If you or someone you know is navigating FND, seeking out specialists who get this, those who look at the whole person, not just the diagnosis, can make all the difference.
Yeah.
Here's to better understanding, better support, and better days ahead for everyone dealing with FND. Thank you so much for tuning in.
Thank you.
Have a good day.
Yes, you too.